is our discussion portion for our video. We just want to kind of run over the behind the scenes of our nurse-client relationship. So our central theme that we focused on was trust, and within this theme we were able to incorporate confidentiality and a lot about the scenario in the bad scenario and how things didn't work out and how we fixed it in the good scenario.
Okay, so how we chose what our scenario would be is that we came up with a list of different scenarios and we voted on the best scenario that would represent what a trust and mistrust in communication would be. And so that's how we picked our scenario, and that's what worked for our group. What didn't work as well was because our schedules were misaligned, so that we didn't have time to meet up properly. So what we did was we had a video chat with each other, and we would organize there and schedule when we'd meet, and that's how we organized when we would film our project as well.
So kind of going off of what we filmed, in the bad script you see that the nurse had a very improper introduction. She didn't really introduce herself at all to the parent or the patient, and she just kind of was acting very rude and bringing them in. Didn't really talk about much with them regarding confidentiality or their privacy. She in fact left the door open, which breached everything right at the beginning and kind of led to the mistrust, which is the barrier of our central concept of trust. And she also didn't terminate the interview in terms that, like, she didn't tell them that she was going to be the nurse just for today or taking care of them for a long time. Versus in the good script, she did use her designation and her name first and last and introduced herself, and then also did like a run through of what the timeline was, so saying that she was going to be the nurse for just that day, and she did assure the patient and the parent multiple times about confidentiality. She closed the door, and that kind of led to the patient being more open about what was going on and how she wanted to communicate with the nurse.
Okay, and also in our bad script, the nurse didn't get any of the client information, her name, anything. She just focused on her clipboard and just kept moving like really quickly. Versus we fixed that in our good scenario where she went through the entire thing and found out who she was and was paying attention to the patient.
Also with the bad script, you can notice that the nurse pays absolutely no attention to the client's nonverbal communication. The client's extremely nervous and is like obviously not wanting her mom to be in the room because she keeps like looking over, and the nurse just disregards this and tells the mom to stay in the room, whereas in the good script she notices the uncomfort and asks the mom to leave the room.
Okay, and in the bad script, the nurse pushes her own values on the patient by stating that she is okay with her mom being in the room, whereas opposed to the mom, where the patient is saying that she wants her mom to leave, the nurse is saying that it's up to the mom and that she can stay. She also provided sympathy to the patient as opposed to empathy, where she stated that she was sorry for the pain and didn't provide any information on whether or not she would get pain medication. Also, she provided false reassurance when she thought that the patient couldn't be pregnant, and she stated that in the scenario.
And in the bad script, we had the nurse assume a lot of things. She didn't let the patient talk, and with that there was no assessment, which again, the nurse is kind of just doing her own thing. But in the good script, she did the assessment, the PQRSTU, and that did allow the patient to talk back, and they could communicate. And along with communication, for the bad script, there was no silence, so part of nonverbal communication.
Yeah, so just like with the silence, like leaving silence at certain points helps the patient reflect and maybe say more about the situation to get more out, and it also just like adds maybe comfort in some areas that they need it instead of just continuously like telling them so much stuff all the time. Yeah, okay, and then also at the very end, the client was referred to as hun, which is super condescending for a nurse to do, and you don't know how that patient feels about like nicknames and stuff like that, it's best to just ask the client what they'd like to be called, refer to them as their first name or Miss whatever their last name is.
So kind of overall, I hope like our video in the good scenario and the bad scenario sort of showed like what a nurse shouldn't do, and then take all of those scenarios, put it in the good scenario, and just kind of fix everything to incorporate what we're being taught in nursing school and how we should communicate with our patients.
Yeah.
Okay.